right now, I would like to invite Mr. Zubin Daruwalla, the Director and Healthcare Lead, PwC Southeast Asia Consulting, to give the opening remarks. Having lived in Ireland and the United Kingdom and Singapore, it's given him full exposure to a wide variety of cultures and life experiences, having obtained full registration with each country's respective medical council. His current interests are healthcare consulting, digital, health and medical education. Mr. Zubin, we welcome you to the summit today.
Hi, good morning, everybody. First, I'd just like to say thanks to Vishwesh and BERG for inviting us to be partners from a knowledge standpoint and helping put together this agenda. Thanks, Vishwesh. I think this is going to be a very brief introduction, okay? I think we're living in a very connected world. All of us are very familiar with this. Just to look at statistics, if you look at numbers, about 3 billion people around the world are connected to the internet. And the statistics show that in the next 3 years, each of us, so in the next 3 years, for every person on the planet is going to have at least 10 connected devices to them. And when we say this number, a lot of people feel very surprised, but if you think about it, you're wearing your wearable, you have your iPhone, your iPad, your iPod, so it's not unrealistic that by then we're going to have 10 connected devices per person. Now, hopping onto this digital connectivity bandwagon is really going to be the key to solving healthcare access challenges. And the figures I wanted to just show here is that if you look at it, spending on services even in rural households, 1/4 of persons, so quite astounding. Now, when we talk about these changes, I think we always use the term digital and digital disruption. Digital disruption, whether we like it or not, really is here to stay. If you look at how long it took for the telephone to get to 50 million users, we're looking at about 75 years. Now, if you move that and say, what about the television? You're looking at 13 years. If you take it one step further, Angry Birds, how long would you say? It took a month to reach 50 million users. And the point that I want to try to get across is that the pace of digitization is really increasing exponentially. What used to take years is now taking days, and we have to be aware of that. Across Asia Pacific, there are multiple examples of mobile health deployments, and happy to share these slides with you. I'm not going to go into each example. Even across emerging markets, and this is where the really interesting thing we're seeing is, even in Southeast Asia, in the emerging markets, there are countless new digital health models being developed, many of which are already revolutionizing the way we deliver care today. Just some examples there. So when we talk about new entrants, and in PwC we often use a term, the new health economy. What do we mean by this new health economy? I think what we're trying to say is that today we're seeing a lot of new businesses using new business models, new technologies, and new ways of delivering care. So these new kids on the block, as we often refer to them, they provide very disruptive models and new ways of working. Okay, and often what we're seeing is that these businesses are traditionally non-healthcare players, and these non-healthcare players are the ones who are disrupting the market in the most ways. So disrupting what's static really will be the cornerstone of the new entrants' business models, with the lines between various stakeholders increasingly blurring. So if you look at a lot of pharma companies, hospitals, anyone in the ecosystem, what they're doing is very out of the box and isn't their traditional practice today. So health systems are really starting to recognize that consumers are ready to receive care in new ways. And this is just a statistic from a survey we did. 82% of respondents said they were open to trying new, non-traditional ways of seeking medical attention or treatment. So what does that mean for all your businesses and for what we see in healthcare? It means, is a hospital of today going to be a hospital like it is in the future? Is there going to be a hospital? You know, is a laboratory going to exist? Is a pharma company going to exist? All these businesses, in 5 to 10 years, the way things are going, their role is really evolving and is changing rapidly. So disruptive trends are revolutionizing the industry and impacting the delivery and financing of care. So just to go through the top 5, we're seeing a lot of demographic shifts and social change. More people can afford to spend more on their healthcare, especially in the private sector. We've seen a shift in global economic power, which we're all aware of from west to east. New technological advances are coming up every single day. The biggest point, the empowered consumer. How many of you here have read a book by Eric Topol called The Patient Will See You Now? Yeah, a few of you. And that's exactly what's happening. I often joke, I still practice 1 day a week. And you know, we sit in our clinic room and patients are sitting outside. I think the way it's going is that the doctors are going to be sitting outside and the patient's going to be in the room. And that's the way care is being delivered. As a patient, you're now a consumer. You're no longer a patient. You dictate where you get care, when you get care, who you get care from. And often you even dictate the kind of care you get with the information that's available. And then there's obviously globalization. What these have really resulted in is the emergence of new business models, like I mentioned, these new entrants. These new entrants are expanding and reshaping the health system, and we have to be aware of that. I don't know how many of you here are familiar with a company in China who is a curtain company, and they've invested and bought a digital hospital, so a hospital with no patients. Where the business models align, I have absolutely no idea. There's a rebalance of the public and private sectors in the financing and delivery of care. Even here in Singapore, we're seeing that with the way billing systems are going and the way we're trying to provide care publicly and privately. There's a greater focus to reward outcomes instead of volume of activity. All of you are familiar with the terms from healthcare to health, from hospital to home, and from quality and volume to value-based care. These are three of the big trends going on today. We're seeing a trend from inpatient care to outpatient services, which is what I just described, and the health sector is really industrializing. So business models are already exhibiting the various elements of successful disruptors in other industries. We give examples. It's actually an animation, but unfortunately it's not working. But if you consider Uber, world's largest taxi company, doesn't own any taxis. Alibaba, one of the most valuable or the most valuable retailer, it doesn't own any inventory. Airbnb, world's largest accommodation provider, it owns no real estate. And then there's Facebook when it comes to media, but they don't own or they don't create any content. So a new era of health is really upon us. And the question is, are we ready for a hospital with no patients?